Hello, I'm Dr. Richard Becker, President and CEO of the Brooklyn Hospital Center. Privacy and security rules are among the most important regulatory challenges healthcare providers face today. The latest changes impose severe penalties for non-compliance on both hospitals and staff. It is in the interest of the Brooklyn Hospital Center, its employees and physicians, and of course our patients, that we all understand our responsibilities for protecting health information. My colleagues Irene Farrelly, Vice President of Information Systems, and Laura Myers, Vice President of Audit and Compliance, will present an overview of the most important aspects of the HIPAA privacy and security rules. You should feel free to contact either of them to ask any further questions you may have. Thank you for your attention today and for helping to protect our patients' privacy every day.
Hello, I'm Laura Myers, Vice President of Audit and Compliance and the HIPAA Privacy Officer for the Brooklyn Hospital Center.
I'm Irene Farrelly, Vice President of Information Systems and the HIPAA Security Officer for TBHC. We are here today to provide an overview of the HIPAA and high-tech privacy and security regulations. Every TBHC employee is required to understand and follow these regulations and the hospital's privacy and data security policies.
Congress created the Health Insurance Portability and Accountability Act, or HIPAA, in 1996. This is a federal law that, among other things, protects patients' health information and gives patients the right to restrict its use and disclosure. HIPAA applies to all healthcare providers, including hospitals, doctors' offices, nursing homes, home health agencies, and health insurance companies. In 2009, as part of the health reform legislation, Congress passed another law, the Health Information Technology for Economic and Clinical Health, or HITECH Act. This law placed new limits on uses and disclosures of patient information, expanded patients' rights, included a new breach reporting rule, and greatly increased penalties for noncompliance with the privacy rules. HIPAA is a federal law, and the agency responsible for enforcement is the Office of Civil Rights of the Department of Health and Human Services. There are two aspects to the HIPAA rules, the privacy rule and the security rule. Irene and I will provide an overview of both of these rules.
The privacy and security rules require health providers to safeguard protected health information, or PHI. PHI is defined as any individually identifiable health information in any form. PHI combines a patient identifier, such as a name, insurance number, social security number, address, or a photograph, with health information such as diagnosis, procedure, or treatment. PHI can be in the form of paper records, information communicated verbally in a conversation, or electronic computerized data, which is sometimes referred to as ePHI. Another term you may hear is PII, or personally identifiable information. This is information that can be used to identify an individual person, and it is often used in the context of identity theft. PII isn't covered by the HIPAA regulations, but is protected under New York State law. As a hospital, we have the responsibility to protect our patients' personal information, such as social security numbers or dates of birth. This protection also includes our employees' PII.
To start with the HIPAA privacy rule, first of all, the hospital and its employees may only use or disclose a patient's PHI for three purposes: treatment, payment, and operations. We may use patient information to treat the patient's illness or condition, and we may share the information with other healthcare providers involved in the patient's care. Payment represents any activity needed to bill and collect for the patient's care. This includes registration, coding, case management, billing, and collections. Operations is very broadly defined and includes business planning, quality assurance, teaching, auditing, and general administrative activities. There are other permitted uses of PHI, such as research, disclosures for public health reasons or law enforcement, and organ donation. But there are restrictions, and employees should consult with their managers, with the IRB, with me, or with the General Counsel before using or releasing patient information for these purposes. The HIPAA regulation recognizes what it terms incidental disclosures. That is, the government understands that it is impossible to completely protect all patient information in a busy hospital environment. Employees must make their best efforts to minimize disclosures, for example, speaking in low tones in a two-bedded room or at a nursing station. This exception does not cover disclosures made through carelessness or neglect, such as speaking about a patient by name in an elevator. HIPAA gives patients rights over their health information. They must be given a notice of privacy practices the first time they come to the hospital for care. They have the right to confidential communications of their health information. They have a right to request restrictions on the use and disclosure of their PHI. For example, they can ask to be omitted from the patient directory. They have a right to a copy of their medical record. They have a right to request an amendment to their health record, although we are not required to make changes if we believe the record is accurate and complete. Patients have a right to receive an accounting of disclosures of their health information. Finally, patients have the right to make a privacy complaint to the hospital or to the federal government.
The HIPAA security rule requires the hospital to ensure the confidentiality, integrity, and availability of the ePHI that we create. We must protect against threats to data security and against impermissible disclosures. And we must ensure compliance with these rules by our workforce. We must have administrative, physical, and technical safeguards to our data. Administrative safeguards include policies and training of our employees in protecting data and information systems. Physical safeguards include restricting entry to our computer room. Technical safeguards include passwords, firewalls, and secure file transfer software for safely transmitting PHI and emails.
I want to review some of the most common risks we face in dealing with protected health information. Probably the most frequent is leaving documents with PHI in public areas, such as the cafeteria. Another major risk is taking documents or electronic devices with PHI out of the facility. A hospital in Boston incurred a $1 million fine and other penalties when an employee took work home that contained PHI and accidentally left her briefcase on the subway. Employees must also remember to properly dispose of paper documents containing PHI. Always use the shredder bins available throughout the hospital. Remember also that patients have the right to decide who shares their health care information. Before speaking to a patient in front of his family members or other visitors, including spouses, always ask the patient's permission and give him the opportunity to speak to you alone.
Flash drives in particular pose a huge risk. PHI on these devices must be encrypted in case of loss or theft. Also, when sending PHI over the internet outside of the NYP email system, the email must be encrypted using the secure file transfer software site available to all who use the NYP email system. Your manager or IT can provide information about how to do this. Every employee has the responsibility to protect their user IDs and passwords. Never share your password with anyone, including your supervisor. We conduct periodic audits of user access to various systems with random reviews by patient, by user, and by function. And if you are authorized to access our systems at your home or in another location, you must take every precaution to protect against disclosure of patient information to family members or others.
And while we're on the subject of family members, remember that employees may not access patient information except as needed to do their job or for legitimate teaching or research purposes. You may not access a patient's record for personal reasons or out of curiosity. Do not look at the medical or billing records of friends, family members, neighbors, or celebrities unless you must do so to carry out activities that are part of your job responsibilities. The hospital is required by law to investigate and report breaches of any patient's health information. By law, a breach is an impermissible disclosure of PHI that compromises the security or privacy of the patient. There are some complex regulations around the definition, and at TBHC, only the Vice President of Audit and Compliance will make the decision as to whether a particular incident is a reportable breach. A reportable breach has to be reported to the patient in writing and to the federal government. If there is a breach of multiple patients' PHI and we don't have good contact information for all of them, we are required to post information about the incident on our website. If the breach involves more than 500 patients, such as if we were to lose a computer, we not only have to report it immediately to the federal government, but also put out a press release to the major media. Obviously, even the breach of one patient's privacy may cause embarrassment to the hospital and perhaps cost us the trust of our patients, so we rely on all employees to help us protect patient privacy at all times.
Another aspect of the HIPAA regulations is the minimum necessary rule. We are supposed to limit access to PHI to the minimum necessary to accomplish our job responsibilities. This doesn't apply to treatment of the patient, but it does apply to other uses of patient data. This is why we are being careful to limit access to our data systems just to employees who need access to that particular system to do their jobs. When a new employee is hired, for example, we will be looking carefully at the systems they are given access to based on their job title and responsibilities.
Now we come to the scary part, the penalties and disciplinary actions for violating HIPAA. First, the HITECH Act greatly increased penalties for violating HIPAA privacy rules. Federal penalties can be taken against the hospital or against an individual. A person can be sentenced to up to 10 years in federal prison for disclosures for personal gain or for malicious purposes. But a person can be sentenced to 1 year in federal prison and a fine of up to $50,000 for intentionally obtaining or disclosing PHI for any reason. That means if you peek at the medical record of a celebrity or your neighbor without a valid reason, you can go to prison for a year. And this has actually happened to some people. A physician in California was sentenced to prison for looking at the medical records of several of his fellow doctors. An emergency room admitting clerk in Little Rock, Arkansas was prosecuted for looking at the ICU record of a patient she had admitted earlier in the day. These examples may sound extreme, but the point is that you may be caught up in a very ugly situation if you violate the privacy rule. It's easy to keep out of trouble. Don't access patient health information unless it's needed to do your job.
The hospital's HR policies include a range of disciplinary actions for privacy and security violations, up to and including termination. A breach that is unintentional or caused by carelessness may result in verbal counseling for a first offense, or action up to termination for a subsequent incident. An intentional violation, such as accessing the PHI of relatives or coworkers without authorization, may result in actions from a written warning up to termination. A violation for personal gain or malice will result in immediate termination and may be referred to law enforcement. Suspension or termination of an individual licensed under the New York State education law will be reported to the appropriate agencies as required by law.
When you've completed this training, you will be required to sign an attestation that you viewed it and understand the HIPAA rules and the penalties for their violation. If you want to learn more about HIPAA and privacy, or if you have any questions, there are various places you can go for more information. You can speak to your supervisor or manager. You can always reach out to me. I'm happy to answer any questions. You can call me at extension 8458 or email me at lmyers@nyp.org. The hospital's HIPAA privacy and security policies are in the TBHC Administrative Policy Manual, which you can read online at mytbhc.org. Your department should also have a copy. And if you really want to learn everything there is to know about HIPAA, you can go to the website of the Office of Civil Rights at hhs.gov/OCR.
Thank you for watching this training video, and thank you for protecting our patients' privacy.